Hello. The Infection Prevention Team would like to welcome you aboard the University Hospital Zurich. The safety of our patients and of you, the members of staff, is important to us. So we'd like to familiarise you with our onboard regulations regarding standard precautions and isolation procedures. You can protect both yourself and patients from infection by wearing the correct work clothing. Your private clothing must be completely covered by work clothing. Short sleeves must be worn for aseptic activities. Please change your clothes every day. Watches and rings are not allowed when in direct patient contact. This also applies to wedding rings. Long hair must be tied back or put up. Long fingernails, artificial fingernails or nail polish are not permitted due to the increased risk of spreading germs. Certain clothing is restricted to certain areas. Leaving the surgical area in theatre scrubs is not permitted. As a member of staff, you care for our patients for the duration of their hospital stay. Bear in mind that certain patients require particular attention in order to prevent the spread of pathogens. Patients with conditions such as respiratory infections, open tuberculosis, measles or chickenpox are always upgraded to isolation class. The same applies to patients who are carrying multi-resistant pathogens or patients who have been transferred from hospitals abroad. Hand hygiene is one of the most important measures for effectively preventing the transfer of pathogens by members of staff. Please always pay attention to proper hand hygiene, particularly before coming into contact with each patient. Take a generous amount of hand disinfectant and rub your hands until they are dry. Personal protective measures are there first of all for the safety of you, our personnel. Non-sterile gloves protect you from bodily fluids and should only be worn where you are likely to be exposed to urine, blood or saliva, for example. Only wear gloves for short periods and clean your hands before putting them on. You should also wear a surgical mask and eye protection if you are expecting to be splashed with bodily fluids. Remove the gloves immediately after use and clean your hands. That way you'll prevent the spread of germs. Ensure an aseptic working method to prevent contamination of clean and sterile materials and areas. Don't forget to clean your hands before aseptic activities such as wound care or injections. If you need to speak during aseptic activities, you should wear a mask. A surgical mask. Our hospital cough etiquette prevents the spread of respiratory infections. If you, as a member of staff, are suffering from coughing or sneezing, you should wear a surgical mask when in contact with patients or colleagues, or maintain the necessary minimum distance of 1 metre. Cough or sneeze into a tissue, which you then dispose of immediately. If you don't have a tissue to hand, then cough or sneeze into your elbow. Every flight has an end. Please make sure that instruments and equipment are properly processed and disposed of after landing. Use the correct disinfectant for this and observe the usage regulations. Sharp objects must be disposed of separately to avoid sharps injuries. Information about our onboard standard and isolation procedures can be found on our pocket card. On behalf of the infection prevention team at the University Hospital Zurich, I'd like to thank you for your attention and wish you a pleasant flight.